What's poppin', guys? Welcome to the steady state summary. In this video, we'll be going over binding caves and interpreting dissociation curves. Drawn here are a pair of binding caves with some different weak interactions going on. When drawing a binding cave, you should show various weak interactions with different parts of the substrate, representing the weak interactions that hold the substrate in place in the active site. In the top left, you can see some hydrophilic interactions between lysine and serine with the sulfate portion of the molecule. Meanwhile, on the right side, there are some London dispersion forces going on with the nonpolar portion of the molecule, with alanine and valine present. In the bottom right, you can see similar hydrophilic interactions taking place with the ethers present, as well as more nonpolar interactions between the benzyl rings and aromatic amino acids, such as tyrosine and phenylalanine. These molecules are not likely to show up on a test. However, hopefully this gives you an idea of what kind of interactions you can expect to see in a binding cave. This will be super important as we get into enzymatic reactions later in the course. Shown here is an oxygen-hemoglobin dissociation curve similar to the one shown in class. The first thing you should notice right off the bat is the shape of the curve, known as a sigmoidal curve. The shape of this curve is a result of cooperative binding exhibited by hemoglobin. As one subunit of hemoglobin binds to an oxygen molecule, the affinity of the other subunits for oxygen increases, up until the point that all sites are bound. Shifts in this curve can be caused by all sorts of things. A shift of this curve to the right would indicate a higher P50 value, meaning that the concentration of oxygen needed for 50% of the binding sites to be occupied is higher relative to normal. This can specifically be seen due to a decreased blood pH and an increased concentration of 2,3-BPG, which is referred to as 2,3-DPG in this figure. These two sorts of things occur during exercise, which makes sense. If you are exercising, you want your muscles to be able to receive oxygen from hemoglobin at a higher rate, so you would want the affinity of the hemoglobin for oxygen to decrease. Conversely, a shift to the left of the oxygen would mean that there is an increase in blood pH and a decrease in 2,3-BPG. This would mean there is a lower P50 value, and in this situation, hemoglobin will be found in the R state, where it has a higher affinity. Knowing how to interpret this graph, as well as what situations would cause shifts to the left or right, is something to practice and understand thoroughly, as this will play a role later in the semester as we begin to further discuss enzyme kinetics. That's all for this video. If you have questions, please reach out to me through email, as well as Dr. B. Stay safe and stay easy.